As more boxes of the Pfizer COVID-19 vaccines arrived at hospitals across Utah, Dixie Regional Medical Center in St. George was among those to receive and properly store the vials for eventual distribution. The vaccines must be stored at temperatures around minus 75 Celsius. They then must be thawed for several hours before dilution. Medical personnel at Intermountain LDS Hospital began preparing the vaccines for administration, which have to be done within 6 hours. The first in line were frontline workers who work directly with patients who suffer from COVID-19. They were happy to receive the vaccinations to keep them and their families safe.
My faith is in the physicians and all of the people that have done so many hours to bring us to where we are. And I'm 100% behind those people, because those people are what keep me safe, that keep my patients safe, and then keep my family safe.
This shot is one of 2 that healthcare workers will receive, the second one to be given in 21 days. For some, it brought peace of mind knowing they will be protected with a vaccine to help their immune system fight against the virus.
I don't know that it's going to make me immune. I don't think it will, but I mean, it's the same thing with a flu shot. Once you get that flu shot, you're resistant to it, but not immune.
Others said it was an easy thing to do.
Yeah, it honestly was, to be honest, it was the easiest vaccine I've ever had. It doesn't hurt at all.
And for others, it's knowing there is hope against this virus for the rest of the country in the future.
There is a light at the end of the tunnel, and it's like way far in the distance, and it's kind of dim, but the light is there. And I know that there will be an end to all the things that we're going through right now. There will still be sick people in this world, and there will still be problems. But this vaccine is a huge step forward to achieving the world that we want to live in.
Symptoms from this vaccine are said to be mild, but healthcare officials are still keeping a close watch.
There does seem to be some minor adverse events. They all seem to be minor. It's only in a fraction of the folks, and they all are particularly mild. And so we don't anticipate too many issues in the near future. We certainly will pay attention to those who've had anaphylaxis in the past.
Moderna will be the next company to roll out vaccines. While this vaccine is said to be about 95% effective against the novel coronavirus, healthcare officials still say it will be a while before things will be back to somewhat normal.
Making the vaccine effective is one hurdle, and it's a huge one. But getting it out to all the people that need it is another one that takes everybody here to do it right and effectively. I have to say, though, my excitement is tempered by the fact that we are leading into another holiday season, and it's going to get colder. And this vaccine does not mean that we can all get together now and that we can all go party and have large gatherings. That is not going to come until the fall of September 2021, when the majority of Utahns are vaccinated.
With an estimated 2,000 cases of COVID-19 being reported per day in Utah, Dunn said there's still a need to be vigilant. She said an estimated 70 to 80% of Utahns need to be vaccinated in order to reach herd immunity. Even those who've had COVID-19 should get the vaccine as long as they haven't been sick with the virus in the last 90 days. In St. George, Melissa Anderson, Community Education News.